Live is brought to you by Dr. Kenneth Odinet.
Welcome back. Right now, we are joined with Dr. Kenneth Odinet. Thank you so much for being here with us today.
Thank you for having me.
Of course. So for those at home who don't know who you are you? What do you do?
I'm a plastic and reconstructive surgeon here in Lafayette. I've been here for 30 years.
30, that's a long time.
Called it home. It's a long time.
So,
it's a lot of surgery.
Yeah. What made you kind of get into plastics and plastic surgery?
Well, I'd gone to dental school first and then decided I wanted to go to medical school. So after dental school, I went to medical school. And you have a lot of options, and it just interests me putting things back together, if that makes sense.
Yeah.
Try both functionally and aesthetically, taking care of trauma, tumors, as well as aesthetic surgery, fighting back aging.
Yeah, and I know that can be hard, fighting back Father Time.
Father Time's still undefeated.
Absolutely. So practicing for 30 years, is there something over that 30 years that maybe have stuck with you over that time? Is there a specific surgery that you liked? You mentioned reconstructive surgery. I feel like that must be so rewarding for someone to come to you and you're able to basically put them back together.
Well, we try depending what their problem is, but, if you can improve their quality of life, then it's a success, and that's what they're looking for.
Yeah.
They're not as worried about scars and things like that. They just want an improved quality of life.
What's the favorite part about your job?
The patients. The patients who appreciate what you've done, you've helped them out. That's what makes it worth it. Difficult patients are tough. You start second-guessing yourself sometimes, but you just got to move forward.
And you don't just do reconstructive surgery, you do aesthetic stuff
Aesthetic
too.
surgery, face, breast, mommy makeovers. Once again, trying to fight Father Time after massive weight loss or pregnancy, seeing how we can help them out. A lot of times they'll have several options. Sometimes there are no options.
So if someone out there is watching this and they are thinking about coming to you for aesthetics, what do they need to do? How can they contact you?
Well, they can contact our office and make an appointment. They'll come in for a consultation. We'll sit and visit, talk about what they'd like and what their needs are, and go through a history to make sure they're in good health and a reasonable candidate. And then we go through a complete exam, and I point out what I think are the big problems, and we make sure we're on the same page, and then we decide how we're going to address those problems.
And what about expectations for whenever they
Big.
step in? Big. Okay.
Most plastic surgeons will tell you that the most difficult part of our job are dealing with expectations. Some people understand what can be achieved, and other people don't understand it, and sometimes refuse to believe it. And with experience and practice, you learn which patients to treat and which patients to just tell them, I don't think I can help you.
How do you handle that honesty with a patient that might come to you with these photos of maybe a prior version of themselves 20 years ago, like, I want to look like this? How do you handle that?
Well, you tell them, well, I'd like to look like I did, 20 years ago, but you talk about, once again, Father Time and what can be done and what can't be done. And some of them are mad at you, and some of them thank you for your honesty. And you just kind of go from there, but you just tell them, I don't think I can help you. Because in the long run, some of them will never be happy, and they blame you for it.
And at the end of the day, I'm sure you want to do your best work possible.
Sure.
Absolutely.
And why wouldn't you?
Yeah.
That's any profession.
I think it's really amazing that you've been here in Acadiana for 30 years doing this for people, helping so many people out there. We are almost out of time, but let's go over where you're located and how our friends at home can contact you.
We're on right off Colley Saloon on Boyer. They can contact our office, and we have a website, and they can go there and they can register and for an appointment at that time.
Dr. Odinet, thank you so much for stopping by to tell us about your journey and your 30 years in the business. Thank you so much for being here.
Thank you.
Of course. If you at home, you want to learn more, go to our website, klfy.com. We're going to put everything you need to know right there. We'll be right back after this.
You're watching Acadiana Live, Acadiana's first and only lifestyle show.